be doing a neurological assessment. So first I'm going to start off by taking a look at my patient and checking to see if her hygiene is within normal limits. So it looks like she bathes daily, cleans her hair, her nail beds are clean, she doesn't have any dirt crusted underneath of her nails, so it shows that she uses good hygiene. Can you tell me person, place, and time?
My name is Alexandria McLean. It is 2017, April 24th, and we're at the Show Building.
Okay. And then I'm going to ask her a couple questions to see if her memory is intact. So first we're going to check her immediate memory. So I'm going to ask her to repeat a couple letters or numbers after me. So 1, 2, A, B, C, D.
1, 2, A, B, C, D.
Okay. And then we're going to check her recent memory. So I'm going to ask her what she ate yesterday.
Meatloaf for dinner.
Okay. And then we're going to check her remote memory. So I'm going to ask her, what year did you graduate high school?
2013.
Okay. It seems to be that her judgment is also intact. And I'm going to ask her to do some math equations for me to check to see if she can do some arithmetic calculations. So we're going to go with, what is 9 times 9?
81.
Okay. And then what is 144 divided by 12?
12. Okay.
So have you had any fluctuations in your mood recently that you might be worried about?
No.
Okay. Take any medications for anxiety, depression, or any psychological disorders? Okay. We can tell by just listening to her voice that it's clear. It's within normal limits for the patient. It's loud, not too loud or overbearing. She's not too quiet or too shy. Her words are articulated very well, and there's no slurring to her speech. And she can comprehend everything that I'm saying, and she can follow simple instructions. She's able to express her thoughts clearly. And so now we are going to start with the cranial nerve assessment. So first we're going to get some different smells, and then I'll hold them up to the patient with her eyes closed, and then she'll tell me what it is. Okay, so I'll have you close your eyes.
Okay.
This is what we have here.
As a orange.
Okay.
Sounds like something with vanilla in it.
Okay. So that's pretty close. She's not going to be able to tell us exactly what it is, but it's pretty close. So that tells us that her smell is intact. Can you tell us a little bit about your vision, if you wear any corrective lenses or anything like that?
No, my vision's fine. I don't wear any glasses or whatever they're called, contacts.
Okay. So it seems that she sees 20/20 near and far vision. We also tested her distance and peripheral vision in a previous exam and an assessment. Now we're going to check the oculomotor, trochlear, and the abducens cranial nerves of the patient. So we're going to check out her eyes. Just by looking at her, we can see that she doesn't have any drooping in her eyes. And then now we're going to check her pupil reflexes. And then I'll have her follow my finger to see if the movement in her eyes is well coordinated and there's no nystagmus. So now that I have my phone here, I'm going to check her pupils and see if they are reactive. Okay, both are reactive. I'm going to have her follow my finger. Okay, good. She had good movement, no nystagmus that I could see. Now we're going to check the trigeminal nerve. I'm going to have her clench her teeth for me. Puff out your cheeks, stick out your tongue, move it side to side. Okay. And then raise your eyebrows up really high. Okay. Now I'm going to touch your face. One part's going to be with the pad of my finger, and then the other part's going to be with my nail, and I want you to tell me if it's sharp or dull, and if they're different on either side.
It's dull, sharp, dull, sharp, dull.
Okay. She did really good. And then we are going to check her light touch sensitivity. So on one side I'm going to touch her arm like with a lighter stroke, and then on the other one I'm going to touch with a deeper stroke, and I want her to tell me which one is which. Okay.
Light. That's deep. That's light. Deep. Deep.
Okay. So she can feel both light and deep through her muscles. Back to the face, and have the patient wrinkle her forehead, and then we'll have her smile with her teeth open and teeth closed. Squeeze your eyes shut. Blow through your mouth with pursed lips. Okay. So this is checking to see if her facial and glossopharyngeal cranial nerves are intact. So as we can tell, they are intact. Now we're going to do the whisper test behind her and ask her, or whisper a couple of different words and see if she can hear us in both ears.
5, 6, 10. 5, 6, 10.
Okay. So we can tell just by watching that her whisper test was correct and her acoustic cranial nerve is intact. And we had already previously talked about the Weber and Ryan test in another video, and I explained how we conduct both of those. So that goes along with the acoustic cranial nerve as well. So now we're going to test the glossopharyngeal cranial nerve. So the patient is going to say ah, and then we're going to look to see if her soft palate raises whenever she says ah. Okay, so we did see that it raised up whenever she did say ah. Another thing we would do is check her gag reflex. So we're just going to ask the patient if her gag reflex has been intact.
Yes.
Now we're also going to ask if the patient has been able to swallow recently.
Yep.
Any problems with swallowing?
No.
Okay. And then as we can tell, this patient's speech is clear and appropriate. So for cranial nerve number 11, we're going to check to see if the patient's shoulder movements are equal. So I'm going to have the patient raise and lower her shoulders up and down. Okay, good. And then we're going to, with resistance, we're going to move our head back and forth. So, okay. Good. So the patient had good resistance and was able to move my hand. And then we're also going to take a look at the hypoglossal cranial nerve. So we're going to have you stick your tongue out and see if it's within midline. And then we're also going to have you make the sounds L,
La,
T,
ta,
D,
da,
and N.
na.
Okay, so she had no difficulty with that, and she's able to move her tongue within normal limits for her age. And now we're going to check the patient's fine motor skills. So we're going to have the patient touch her thumb to each of her fingers and show us on the camera. Okay. Good, so we can tell that it is within normal limits for the patient. It shows that her cranial nerve is intact. Okay, now we're going to have the patient touch her nose and then touch my finger. I'm going to move my finger around her visual field to see if she can follow. Okay, good. I'm going to have the patient take her heel and move it up and down her shin. We can see that she's able to do that on both legs with no difficulty. And while we have the patient standing, we're also going to check her balance. So we're going to have her close her eyes. See if she can stand still for a couple of seconds without tilting over. Okay, good. You can open your eyes now. Now we're going to have the patient hop on one foot to see if she's able to do that.
I can't, but I'm afraid I'm gonna fall.
Okay. And now we're going to have the patient walk back and forth so we can check out her gait. Just walk to the corner and back. Okay, and back. Okay, her gait is within normal limits for the patient. Now we're going to check the temperature sensation of the patient. So I have a water here that is colder than room temperature, so I'm going to have her touch it and see if she's able to tell us that if it's actually cold or warm or hot. So, does it feel colder?
Yes.
Okay. So she has the same sensation as what I do, so that's normal. And earlier we did the deep and superficial pressure, and she was able to do to recognize which one was superficial and which one was deep. And then I'm going to do pinpoint and 2-point pressure on her body. So with this test, I'm going to use both my fingernails. I'm going to use the top of her hand. Okay, just hold it up here. So I'm going to ask you to close your eyes, and you're going to tell me if you feel 1 or 2.
Okay. 2.
Sorry. Okay.
2. 1. 1. 2. 2. 1. 2.
Okay. So we can see that she can differentiate between 1 and 2 different points. Now I'm going to have the patient close her eyes. I'm going to place a couple different objects in her hand to see if she can identify what they are.
Pen.
Okay.
Hand sanitizer.
Okay.
Orange peel.
Okay, good. So that's going to conclude my neurological assessment.